Okay, we are live. Welcome everybody. My name is Dave Reed. I'm the Community Engagement Manager at Mondoweiss. This is the first time we've hosted a live stream like this, and we appreciate so many people joining us today. We hope you all are staying safe and healthy. Mondoweiss is an independent nonprofit news and analysis publication from a left progressive perspective on the Israeli occupation and its impact on US politics. We publish articles every day looking at how the media covers the conflict, cultural issues, and news on the activist movements that are working toward Palestinian liberation. Today, we're going to hear from our Palestine correspondent, Yumna Patel, and our founder and senior editor, Phil Weiss. Yumna is based in Bethlehem, which has become the epicenter for the coronavirus outbreak in the West Bank. If you're joining us through Zoom, please post your questions in the chat window. If you are watching on Facebook, post the question in the comments and we'll answer as many as we can toward the end. With that, let's turn to Yumna to hear about what life is like right now under both a public health lockdown and Israeli occupation in the West Bank.
Thanks, Dave. Again, hi everyone. I hope you're all staying healthy and as safe as you can during this time. I'd like to take you all through a timeline of all the important developments that have happened in Palestine since the first case of coronavirus was confirmed here on March 5th. I'm going to start out with a focus on Bethlehem and then sort of move into news from other parts of Palestine. So as Dave mentioned, I live in Bethlehem, which is the epicenter of the coronavirus outbreak in Palestine. 3 weeks ago, the first case of the virus was confirmed among staff members at the Angel Hotel in Beit Jala, which is the town that's adjacent to Bethlehem. The staff members allegedly contracted the virus from a group of Greek tourists who were visiting the city. Almost immediately, within 24 hours, Bethlehem was put under lockdown, both by the Palestinian and Israeli governments. The Israelis shut all of its borders and checkpoints with the city, and the PA declared a state of emergency and ordered a closure of the governorate, meaning no movement was allowed between Bethlehem and other parts of the West Bank. At the beginning, I think the thing that really shook people here and made them think, wow, this is serious, was the closure of the Church of Nativity, which is the birthplace of Jesus, and the shutdown of the city's tourism industry. That meant all hotels, restaurants, and souvenir shops. It was the first time that the church was closed since the 40-day siege during the Second Intifada. And in fact, many of the residents that I've spoken to over the weeks, especially at the beginning of the outbreak, have expressed to me that the last time they saw the city this empty or this ghost-like, as they say, was during the early 2000s during the Second Intifada. Bethlehem is a place, as you may know, that is totally and completely dependent on tourism and the tourist industry. Every year, tourists come from around the world in the millions to visit the city and its holy sites. Whether you own a souvenir shop, you work as a tour guide at a hotel, or work in the service industry, the likelihood that you depend on tourism for your livelihood is extremely high here. So the shutdown of the city couldn't have come at a worse time. March and April, so where we are now, is typically the high season of tourism in Bethlehem, especially around Easter. So people wait all year for March and April to come to basically sustain themselves through the rest of the year. So it's hitting people really hard. The majority of the city are currently out of jobs, with the exception of journalists like myself, health workers, government workers, police, and people who work for companies or NGOs that are allowing them to work remotely from home. We've yet to really measure the damage that's been done to the city's economy because obviously this is still ongoing, but people, from the very beginning, literally from the first day that this happened, people have said, this is a disaster for Bethlehem. Even in the best case scenario, if things were to get back to normal in the next 2 or 3 months, it's going to be a long time before tourists start to feel like they can come back here. And it's going to take even longer for people to get back on their feet. I do want to mention, though, that in the absence of government subsidies, local communities and neighborhoods are really stepping up for one another. Community ties is a really important part of Palestinian culture, and people haven't just let that go, during this pandemic. In the Ida refugee camp where I live, local recreational centers have partnered with the local council to pool all of their resources together in order to provide food parcels and other essentials to families who are out of work right now and in need of some help. So every day we see volunteers, walking through the camp. They're fully equipped with gloves, masks, etc. And they go around and drop off huge bags of fresh produce, canned goods, and different hygiene products to the houses in the camps. Despite how much the people are suffering, there has actually been little pushback against the government, and people have been abiding by the lockdown and the movement restrictions set by the PA. For the past 3 weeks now, there's been very little movement in the streets. People are only really leaving to buy groceries, or if they need to go to the doctor or the pharmacy, just for essential reasons. And consistently over the past few weeks, the PA has stepped up its restrictions on movement throughout the city. So at the beginning, people could still, move around the city freely, but now there are, police checkpoints between all the different neighborhoods to sort of restrict everyone to their respective neighborhood and keep people from moving around too much. But from the very beginning, I think that people pretty quickly understood the importance of social distancing and that the actions of one person could really affect the whole community. There's a general attitude towards the PA and its containment measures that is actually quite a very positive one. I think people are generally supportive of the measures that are taken by the government. They see it as something beneficial for them, for their community, and for their health. And they're proud of the fact that in the 3 weeks since the first case was reported in Palestine, as of today, we only have 62 confirmed cases of the virus, which in comparison to other countries like Israel next door, which has over 2,000 cases now, is pretty great. In the last week, the government also announced that 16 of the original COVID patients from Bethlehem were in recovery, which was really good news for people and gave people here a lot of hope. As for those who do violate the curfew in Bethlehem or the restrictions imposed by the government, the police have been arresting people who have been found to be breaking any of the rules, and anyone who's caught violating a quarantine order can be fined up to 1,000 Jordanian dinars. So while the majority of the cases are from Bethlehem City, a number of new cases are being reported outside of the city. According to documentation from the UN, around 20% of the cases are in Ramallah, which has also been put under complete lockdown by the governor there. Other cases have also been confirmed in Nablus, Tulkarem, Hebron, prompting those cities to enforce similar restrictions that have been put in place in Bethlehem. Additionally, over the weekend, one of the big pieces of news was that 2 cases were confirmed in the Gaza Strip. As many of you know, Gaza has been under an Israeli air, land, and sea blockade for the past 13 years. It's home to 2 million Palestinians, 70% of whom are refugees and are living in overcrowded refugee camps that lack proper water and electricity infrastructures. Gaza's healthcare system has been on the brink of collapse for years now, and it's widely understood that any level of an outbreak in the territory, big or small, would just be an absolute disaster for the people living there. So far, Hamas authorities in Gaza say they have contained the virus and are quarantining the 2 men who tested positive in a special field hospital in the southern part of the territory. Since March 15th, all incoming travelers from Egypt and Israel have been sent into isolation in Gaza for 14 days. There are 21 quarantine facilities that have been set up in different health facilities and schools, and they're currently holding around 1,400 people in quarantine in Gaza. Additionally, over 2,000 people who entered Gaza prior to March 15th are currently in self-isolation in their homes. One of the things that I did want to talk about is I want to talk a bit about access to testing and treatment, access to hygiene products, food products, et cetera, which I know has been a big issue in places like the US. A lot of the questions I've been getting from friends and family are, questions of concern. If, how are you going to get tested? If you feel sick, how do you get tested? So far, for now, access to testing has been relatively smooth for Palestinians in the West Bank. Anyone who has come into the country through Jordan is immediately tested for symptoms by the Palestinian Authority, and they're ordered into either self-isolation or into one of the dozens of government quarantine centers. If anyone fears that they may be exhibiting symptoms of the virus, there's a hotline that they can call that's administered by the Ministry of Health, and health workers will come to your home to test you and test your family members and other people you've been in contact with. So surprisingly, I think there was a big fear at the beginning of this that the government, wouldn't be able to sustain itself during an outbreak like this, but so far, accessibility to testing has been good. It's been reported by the, Ministry of Health officials that most people in Palestine who have tested positive for the virus have been exhibiting very mild symptoms, and we have yet to have any serious hospitalizations. So we still can't really measure or scale how well we're doing in terms of treatment, but there's this big hope that it won't get to that point, because as is in Gaza, it's obviously not to the same extent, but the healthcare systems in the West Bank are not the greatest either. There's a limited number of, machines and equipment, for example, ventilators. And if the situation were to escalate, people fear that the hospitals would not be able to sustain that sort of outbreak in places like we're seeing in Israel. So that's why the government has poured so much of its efforts into just the initial containment, because they really can't afford to, to get past that point. So that's everything that I have for now. I'd like to now open it up to questions from Phil and then from our audience members as well.
Great. Thanks, Yumna. That was a very helpful overview, and thank you for being there and informing us. It's been fascinating to read your accounts. I was moved by your latest story where you said that this is the most beautiful time in Palestine. The almond flowers are coming out, and the fig leaves are beginning to come out too. My fig tree here is starting to leaf out, so I could relate on that. And so I'm wondering, and everyone's inside at this kind of most beautiful time. I guess what's your life like right now? How much have you been able to get out? Do you get to see the fig trees leafing out? Where are you getting your food? Tell us a little about your life personally, how it's been affected by this.
So my life, obviously, as a journalist is a little bit different to the, the average person here in Bethlehem. As press, we are allowed to move around the city freely in order to, access stories or interviews when we may need to. That being said, I do try as much as I can to stay inside and practice, social distancing, just so, for the sake of myself and for the sake of people around me. Like I said, the streets are, really empty. The only places that are open are grocery stores and pharmacies and, clinics and stuff. The only time I do leave the house, if not for a story or for work, is if I do need to buy groceries. And I try to get as much as I need or as much as I can at one time, so I'm not constantly going outside. So my fridge and freezer have been well stocked. That being said, the reality of the stores is very different here than what I've been seeing in the US and what I've been hearing from friends and family in other places. Everything here has been very civilized in terms of, when you go to the grocery store, the shelves are fully stocked. People aren't wrestling each other for toilet paper or other, hygiene products. Everything is there. And people are sort of just buying what they need, and they're not hoarding or sort of panic buying. People seem to just be buying what they need in order to limit the amount of times that they go outside, which is what I've been doing as well.
Huh, that's interesting. Thanks. So I'm also curious about the whenever I've been in Bethlehem, I see hundreds of people carving religious artifacts to sell. And is any of that? Do you see that work still going on? Or is that just completely stopped? And the whole sort of Christian feeling of the place, how much of that can you even observe right now?
I mean, everything from the very first day has just been brought pretty much to a total standstill. And the place where you could feel that the most was in Manger Square and the area around the Church of Nativity. As you know, there's dozens of, factories and souvenir shops and people doing olive woodworking and all these sorts of things, fashioning different religious figures and souvenirs, and all of that has just come to a total standstill. People are just staying at home. Businesses have stayed closed for the past 3 weeks. If people, from as far as I know, people have not continued that sort of work just because, first of all, they can't afford to. There's no income coming in, so people can't really afford to continue the production of souvenirs and these different sort of artifacts. But the people who are continuing it are doing it from within their homes or their workshops, if they have at-home workshops.
Thanks. One of the things I've found kind of inspiring, but also sort of cheap in some of the commentary from Israel and the liberal Zionist community here is, well, this just shows there are no borders. Everyone is in the same boat, and can't we all just get along? And the occupation is a human thing, and it's not nature, and we can transcend it. And yet, I guess I've seen a lot of evidence that the occupation is still very much alive and well. There was that grisly report that you posted that I've seen elsewhere too about a Palestinian laborer who tested positive, who was dumped by Israel at the across the fence or the green line, whatever border it was. I heard that the raids on the refugee camps in Bethlehem, nighttime raids and arrests are continuing because that's the business, they have to continue for Israel's security. And the soldiers are just wearing extra gear to protective gear. And and lastly, I mean, just the fact that, as you say, the numbers in Palestine seem to be so much lower than Israel right now would seem to reflect the fact that freedom of movement and walls and restriction and martial law are not a new thing
Right.
in Palestine. So I'm wondering how you'd respond to that sort of impression that I have.
Yeah, like you said, you put it quite well, is that the occupation is still very much alive and well. I mean, from the very beginning, you could feel it, that Israel immediately, shut down its checkpoints surrounding Bethlehem and other cities, which, very much reminded people that at the end of the day, Israel is still very much in control of life here. One of the things that was very shocking, one of the things that you mentioned that was really upsetting for people was the continuous raids that were happening specifically in Bethlehem. At the beginning, when this whole thing started and Israel, closed off the borders, people were joking here that, oh, maybe, yeah, we have to deal with coronavirus, but maybe we'll get a break from the Israeli soldiers because, they won't want to come into Bethlehem. But the reality was that, although I would say less frequently than normal, the soldiers still have been conducting raids. Last week, a number of soldiers raided the Dheisheh refugee camp, which is one of 3 refugee camps in Bethlehem. And they arrested a number of people, for political reasons. And photos of the raid just went viral on social media because it showed the soldiers wearing masks and gloves, and some of them in full, protective health gear, while carrying automatic weapons and holding them at the heads of young Palestinian men. So the reality of the occupation is still very much there. As you mentioned, the very big story right now is the treatment of Palestinian laborers and workers inside Israel. There are around 60,000 Palestinians who work in Israel, primarily in construction and agriculture. Last week, there was an agreement that was made between the Israeli government and between the Palestinian Authority to allow the workers, they were given a 3-day window in which they were allowed to go into Israel. And once that 3-day window was closed, they were told that they were going to have to stay in Israel, which was pretty unprecedented for Israel to allow Palestinian citizens of the West Bank to be sleeping in Israeli territory, because typically Palestinian workers, their permits only allow for them to be there during the day, so they have to come back home every night. But in this case, Israel and Palestine agreed that for the sake of, not transmitting the virus back and forth between Israel and the West Bank, that the laborers would be allowed into Israel, but they would stay there and they would be given, proper accommodations by their employers. Well, that's turned out to not be the case. Like you said, in the past few days, there have been several cases, not just one, of Palestinian laborers who have been exhibiting symptoms of the coronavirus. So fever, coughing, body aches, etc. And they've been thrown at the checkpoints between Israel and the West Bank, either by Israeli authorities or by their Israeli employers, and basically told to go home. So I've spoken to someone who was an eyewitness in that video that you were talking about, and also laborers who are inside Israel right now. And they're saying that if they exhibit any symptoms of the coronavirus, they're not treated inside Israel. They're denied medical care there by their employers, and they're told to go home. If they don't go home by themselves, the employer will call the Israeli authorities on them, and they'll be forcibly transported to the border. So that's obviously raised a lot of human rights concerns, is that, Israel wanted these workers to go and work there to, sustain the Israeli economy. But then the second any of the workers exhibit any symptoms of being sick, they're thrown back into the West Bank. And when they're thrown back, this hasn't been coordinated with the Palestinian Authority. So you have sick workers showing up at checkpoints, and that poses a huge, health risk and health concerns for Palestinians in the West Bank, because, people have said they should be, if they're going to be transported back, they should be transported, between ambulances on the Israeli side and the Palestinian side, and more measures should be taken to protect the health of the workers, but also the health of the community. So yesterday, the Palestinian Prime Minister ordered all Palestinian laborers to come back to the West Bank. I mean, this is less than a week after they said that everyone can go to work in Israel. Now they're all being ordered to come back to the West Bank. And the PA says that all workers who come back will be immediately put into a 14-day quarantine. But again, there's a lot of doubts as to how they're going to be able to enforce that, how they're going to man all the checkpoints, if they're going to be coordinating the return of the workers with the Israelis, or if this is just going to be something that, just happens and people have to catch up as it does. So that's sort of the biggest concern, I think, that it's on people's minds right now. People are obviously concerned for the treatment of their friends and family who are laborers inside Israel, and then also about the risks that they do pose when coming back here.
Thanks. It's disturbing. I mean, every time it's just very upsetting to hear that. I just have one more question. I see that we have a lot of people who are on the call who would like to ask questions, and I think it's best to let them ask questions. But I just wanted to ask about where people are getting their information. One of the funny things that's happened in the United States is that you hear people like Andrew Cuomo, the governor of New York, and even Mike Pence a little bit, the vice president, have gained in stature in recent days because people really want trustworthy information, and Cuomo certainly has risen to the occasion, apparently, or seemingly. And people are glued to their TVs and, you know, on the net. I'm wondering where Palestinians are getting their information, and if the PA's status has been enhanced by this, as you seem to indicate in your intro. I mean, people seem to trust what the PA is saying. Are Palestinians listening to Netanyahu's speeches?
Yeah, I mean, it's definitely a bit of, you know, the same thing going on, like you were mentioning in the US. There is a lot of false information that's being circulated and lots of speculation. That's specifically in regards to social media, where I think a lot of people get their news from here. There are lots of rumors going around, but the sort of Cuomo-like figure in this situation has been the Prime Minister, Mohammed Ishtaya, and he sort of gives these almost daily announcements on television here, where they update the situation, and then they'll also do updates from the Ministry of Health. But I would say that the Prime Minister, Ishtaya, has been sort of that uniting figure and someone that people can really turn to, and someone that people are turning to for their news. You know, people are very split here in terms of what they think about the PA and their opinions about the PA in general. And I think overwhelmingly the attitude towards the PA is typically a negative one. But in this situation, specifically regarding the Prime Minister, I think that is changing a bit, and like the overall sort of reception is quite positive. In terms of looking to, you know, Netanyahu's daily updates, I'm sure that people do. The people that that I'm in touch with are actually more so looking at what Trump has been saying, just because I think of how outrageous it is to people. And they just can't really wrap their heads around the fact that this person is the president of the US. But the main source of information that people are turning to here is definitely, you know, the Palestinian Prime Minister. President Mahmoud Abbas has just been holed up in Ramallah because he's very old, and they're limiting his access to people and anything, you know, for his health and safety. So people are definitely relying on the Prime Minister and relying on the PA, and specifically the Ministry of Health, to give them these daily updates through television, and then also through social media as well.
Great, thanks. Dave, why don't you let us hear from some of our viewers?
Yeah, absolutely. That was so great, guys. Thank you. We've got a number of good questions in the chat. Our friend Dr. Alice Rothschild, this kind of ties into what you were just talking about. She asked, what do you think will be the political impact of COVID-19, the coronavirus, in the West Bank and Gaza? So you spoke a little bit about what the PA is doing, but what do you think? What do you know about how people are thinking about the longer term political impact?
Yeah, I think that it's very much up in the air as the situation continues to develop. If the PA can manage to, you know, slow down the curve and sort of keep the virus from spreading any further, I think it could actually work in a great deal of favor for them, because in the past few years, they've, you know, been falling more and more out of favor with the Palestinian public. But this seems like a chance for the PA to sort of turn that around. And that, again, that is if they can manage to contain this virus, because if it does get out of hand, I think that could easily flip again, and it could be a big disaster for, you know, for the PA and their political future. Specifically, like I mentioned, in regards to this issue of Palestinian laborers, because people, people are already talking on the ground about how this was a big mistake on part of the PA to let the laborers into Israel in the first place. And so depending on how they handle this situation, I think is going to be very telling of how things are going to turn out for them in the future, in the long term.
We've got a couple of related questions about Palestinian prisoners. Do you know much about the conditions for Palestinians that are in Israeli jails?
Right.
Do you know about the conditions inside jails or detention centers that are run by the PA? And a related question, here in the US, people are mobilizing to try and get folks in those detention centers released. Is there something like that going on? I mean, obviously there's always mobilizing to get Palestinian prisoners in Israel released. Is there any specific organizing around this particular crisis?
Yeah, that's a great question. Like you said, there is this constant sort of fight for the release of all Palestinian political prisoners, and there are entire organizations that are dedicated to this movement here. That has been stepped up in recent weeks since the outbreak began. There has been a renewed call from the Palestinian Authority and then also from NGOs and rights groups here, is basically calling for the release of Palestinian prisoners during this time, specifically Palestinian children who are in prison and chronically ill patients, chronically ill Palestinian prisoners who have pre-existing conditions and different health issues that make them particularly susceptible to the negative, effects of this virus. Those calls were stepped up and amplified after reports surfaced that, a number of Palestinian prisoners across different prisons were put into quarantine after it was feared that they came into contact with Israeli prison authorities who had the virus. So far, no cases of Palestinian prisoners have been confirmed, but there has been exposure. And so that's definitely a big topic that's on everyone's minds right now here.
We also have a couple of questions related to aid that's coming in and UNRWA. So do you know much? Can you talk about the food chain supply in Palestine and how international aid is being affected by this, and in particular, some questions about UNRWA and its ability to function?
So right now, so we can start with UNRWA. UNRWA has been in a very bad financial state for the past few years, ever since the US pulled its funding for the organization. So they've had to significantly reduce, their services and the amount of aid that they can provide. UNRWA's in charge of the administration of Palestinian refugee camps in the West Bank, in Gaza, and also in the diaspora as well. As far as I've seen here, the UNRWA has been working in tandem with local organizations in the camp. So like I said, these recreational centers, youth centers, local councils, to sort of administer the distribution of hygiene products, information, pamphlets for refugees on how to deal with the crisis, etc. But in terms of actual, food supply and who's supplying specifically the refugee community with food and other forms of aid, what I've witnessed is that that is mostly coming down to the local councils and centers. So I hope that answers the question.
Yeah, that's great. There was a question about campaigns underway to lift the siege of Gaza. Have you heard anything about those campaigns maybe being like temporarily paused, or is there any guidance from officials in Gaza about that? There's a question about, is that a way for the virus to maybe enter and spread more? But I don't think many people can get into Gaza at all. So
right. Yeah, there's always, these ongoing campaigns to lift the siege on Gaza. I don't know if that has been particularly affected in one way or another since the outbreak. I have seen, people posting about Gaza and sort of the dire situation that people there are in, and sort of this, the campaign to lift the siege has been amplified by some voices and saying that we need to lift the siege on Gaza in order, in case that an outbreak did happen, enough medical supplies would be able to be sent into the territory. And if needed, people would be able to travel outside of the territory for treatment and stuff like that.
On Yumna, did you report today that there are 40 ventilators in Gaza for 2 million people?
I've seen some different figures, but the number that I've seen is somewhere between 57 to around 62 ventilators in the Gaza Strip, which is home to more than 2 million people. So like we talked about before, that's sort of the major concern, is that if this situation escalates, there is just absolutely no way that the healthcare systems and the hospitals in Gaza would be able to sustain that and treat more than 55 to 62 people on ventilators if they needed it. And that's, that's not including chronically ill patients, people with pre-existing conditions who already need those ventilators for their condition, outside of coronavirus patients.
That's great. I was going to ask about that. What do you know about the quarantine procedures that are in place in Gaza and in the West Bank?
So like I mentioned before, anyone coming into the country in both of those territories is immediately being placed in quarantine. They're immediately tested for symptoms at the border and placed into quarantine in different facilities. In the West Bank, it's a mixture of people being put into at-home quarantines and then people being put into quarantine facilities in Ramallah or Bethlehem or whatever, designated facilities. I know in Gaza, everyone that's come in to the country in the past 10 days have been put into, everyone that's come into Gaza in the past 10 days have been put into these government facilities, whereas people before who had come in the country before, March or at the beginning of the month, have been ordered to, stay at home. But they're taking it really seriously. Obviously, I'm not in Gaza, so I can't speak to that. But from what we've read from, UN documentation and stuff, it seems that there are very similar measures that have been put in place in both the West Bank and Gaza. And people are taking it very seriously, specifically when it comes to people that have come in from outside of the country.
Yumna, when Mohammed Shtayyeh addresses his people, is he also speaking of Gaza in those? Is that an important part of what his messaging, or is there a split there?
I think there's definitely a split, but it's more underlying. Like you can see on all the official government announcements and results, they just refer to Palestine, and within that, Gaza is included. But when it comes to the details of, the procedural measures and everything in Gaza, that is being addressed by Hamas authorities in Gaza. What Shtayyeh is addressing is the procedures that are going on in the West Bank and the thing that, his government are specifically in charge of. So there's definitely, when they talk about the total number of cases in Palestine, they include Gaza in that number. But when it comes to sort of addressing people and the different procedural changes that need to happen, et cetera, he's very much just addressing the West Bank.
And Adam Horowitz, executive editor, points out that in the United States, we're seeing water companies opening the flow of water despite water bills, that type of thing, but despite restrictions of a political or economic character. Mekorot is, of course, the Israeli water company that controls and limits water to Palestinians. Has there been any suspension of the kind of really cruel and harsh restrictions on water to Palestinians that you've observed in this crisis?
As far as I know, everything remains as normal in terms of how water is being let into the West Bank. I know that in Bethlehem specifically, what the city did to address a potential water shortage, obviously with everybody at home, people are using water a lot more often. So sort of knowing that Israel wasn't going to increase the amount of water that was being let into Bethlehem, or into Palestine, what the city did was they shut off the water for all of the businesses and places that weren't working anymore. And these sort of non-essential, businesses and stuff like that. So in order to sort of curb any water shortages that would happen, as far as I've experienced, we have yet to run out of water. That's also could be related to the fact that it is still wintertime, and in general, people use less water in the winter than they do in the summer. So that could very much, this issue of water is very much subject to change. If if this continues into the summer months, and that could present a huge problem that I think eventually Israel might have to face in terms of easing the water restrictions on what gets let into Palestine.
Thank you for that.
There's a question in Zoom about, have you heard of any artistic efforts going on to sort of lift up spirits in the refugee camps or in Bethlehem or anywhere else? We've seen these videos from Italy of people kind of going out on their balconies and singing.
Mm-hmm.
Is there anything like that happening?
And there's been a lot of music in the States. There's been a lot of people using music.
I think that those videos inspired people here in the past. A few days ago in Ida refugee camp, and then yesterday in Dheisheh refugee camp, basically all the local DJs who were living in the camp went up to their rooftops, because in the refugee camps, you typically don't have balconies. So everyone went up to the rooftops, and all the different neighborhoods, they blasted, different music, some patriotic songs, some just, fun pop songs. They blasted those from the rooftops, and everyone in the camp was encouraged to go to their rooftop and light up their, turn the flashlights on their phone, and sort of it turned into a bit of a party here. And I know I saw videos also from friends in the Dheisheh camp that they did the same thing. So those are some of the efforts that I've seen, and it definitely, people really enjoyed it. People were really excited about it when it was happening. So I think it definitely was successful in lifting people's spirits for sure.
Great, thanks.
I think we're coming up toward the end. There are a couple other questions here that I want to get to. Just a clarifying question about where the testing kits are coming from. It's my understanding that Israel got a certain, or has a certain number of them, and then they passed a certain much smaller number on to Gaza and the West Bank. But do you know anything about the kind of chain there of testing kits?
The original numbers that we received was that around 400 testing kits, I believe, were sent into the West Bank, and 200 testing kits were sent into Gaza, which, is virtually nothing compared to the population. I couldn't tell you now if since then more testing kits have been sent in, but as far as we know, and as far as has been reported, is that those initial numbers, 200 for Gaza, 400 for the West Bank, those are the amounts that were sent in. And again, as the situation continues to escalate, it would be, the Palestinian government would be totally relying on Israel to send in more tests. But that could present a huge problem, because as we see, Israel is experiencing a very huge outbreak. I mean, there are over 2,000 cases, and they're struggling to sort of get everything contained. So obviously, testing their own citizens is going to be a priority for them, which is reflected in the numbers of tests that were sent here initially. So yeah, we're going to have to see as the situation continues if more tests are going to be sent in or not.
And have you heard anything, the different resistance, the different Palestinian resistance groups, have any of them issued statements? I haven't seen any, but maybe they have. Or is there any coordination going on? What's going on with those groups?
I haven't seen anything either, to be honest, except maybe within the different factions within like local neighborhoods and communities, for example, like in the refugee camps, so Fatah or the PFLP or whatever, you know, the different representatives of those factions might release statements just in regards to, you know, maybe maintaining public order and following procedures and that sort of thing. But in terms of, you know, resistance activities or anything like that, I haven't seen anything from the very beginning. The PA very quickly put a ban and a stop on any, you know, marches and demonstrations and anything like that. So those have been, you know, we haven't seen any sort of movement from those groups since this all started.
Thanks. And I think the last question, then we'll wrap up. What's the situation? Do you know about the situation for Palestinians in East Jerusalem?
Mm-hmm. So something we saw that came out of East Jerusalem recently that I think shook a lot of people was that there were some volunteer health workers, Palestinian volunteer health workers in the neighborhoods of East Jerusalem. And there was a video that surfaced showing Israeli police arresting one of the workers. It remained sort of unclear why, but that sort of struck a chord with people, is that, you know, these Palestinian communities in Israel are typically, you know, disenfranchised and treated as, you know, second-class citizens. And that was seen at the very beginning when this outbreak happened. The initial procedures and things that were released by the government were released only in Hebrew, and they didn't address the, you know, gigantic Arab population in the Arabic language. So in Jerusalem, I think it's pretty much the same. I couldn't tell you, to be honest, if there's any, like, you know, the specifics of what's happening there.
Great, thanks. Well, we're going to go ahead and wrap up. Phil, Yumna, do you all have any final thoughts or final points?
I think Phil is maybe on mute.
Oh, sorry. I was blathering on mute. That's brilliant. Okay, sorry. The question about water, I want to say, came not from Adam Horowitz, but from Facebook. And I thank people for the putting questions on Facebook. Also, I want to say that, you know, I'm planning during this self-isolation to learn how to cut my own hair. I haven't got there yet, so but maybe the next time. So thanks so much, Yumna. This has really been excellent, informative. Thank you for your, you know, great work, and it's just been, you've really given us a window on a situation that the American media don't seem to care as much about, and so thank you.
Thank you. I really appreciate it.
Dave,
Okay,
any
all right.
last thoughts?
Yeah. All right, well, we're going to go ahead and wrap up now, folks. We want to thank you all again for joining us today. This week, we're launching a new email newsletter focused on the coronavirus crisis in Palestine. Yumna's going to write dispatches from Bethlehem for it to keep us updated from her perspective. You can sign up for it at our website. We'll include a link in a follow-up email to everyone. Just as a reminder, Mondoweiss is a nonprofit publication. Our content is free. We don't have a paywall on our website. We're funded by readers. And if you enjoyed this opportunity to hear from our correspondent on the ground in Palestine, please make a donation. It enables us to offer more content like this in the upcoming days and weeks, and it looks like months, while this health crisis unfolds around the world. You can donate securely online by visiting our site at mondoweiss.net/donate. Every little bit helps. We appreciate your support for our independent progressive coverage. Thanks, Yumna and Phil, for a great program. Everybody, please stay safe and healthy. Wash your hands and follow the guidelines from the World Health Organization so we can help prevent the transmission of this. Thanks, everybody. Have a good day.
Thank you.
Thank you.